Uh, I would like to greet everyone. Today it's July July 10 is a Sunday. I meant to do live last week, but last week I was so busy I couldn't come. So I'm so glad that I can make it today. Um, my name is Yannick Dantiste. I am a family nurse practitioner based in West Palm Beach, Florida. Um, so I decided today to discuss about one topic that this week I have received like 3 or 4 alerts from public health department. So I opened, I saw those alert. I said, what? Why they are sending me 3 or 4 same alert? So I read through it, and it was fentanyl overdose. Fentanyl overdose right now. It's a really public health um, safety issue because it's well right now. I live in Florida, but this is not something really affected Florida. Fentanyl overdose is a nationwide issue. I wouldn't even say worldwide. At least let's keep it for nationwide. So we have it, in Florida. We have that in New York. We have it in Washington. It's all over. But particularly in Florida, the government has seen an exponential increase in overdoses associated with fentanyl. So, what is fentanyl? First of all, fentanyl is a controlled substance, so it needs to be prescribed. And also, this it's a narcotic. It's a medication for pain. So we give fentanyl to a patient when they have uh, moderate to severe pain because it's very potent. Like they said, fentanyl is a powerful synthetic opioid. This is an opioid drugs. It's up to 100 times more potent than morphine. So let's say somebody take morphine. If we give that person fentanyl instead of morphine, that fentanyl is 100% stronger than the morphine. So it's a very potent, it's a very strong pain medication or narcotics. Um, so what the healthcare department has discovered is that the recent overdose and death associated with fentanyl is related to illicit drugs, which is, if you mix that with cocaine, ma with marijuana or counterfeit prescription drugs like, let's say, oxycodone, Percocet, all those drugs. Okay, as a result, all those illicit substance, that person won't know, if the fentanyl, if it's counterfeit, like it's a fake one, because when it's a fake one, they mix stuff in it, so it's not the real one. In 2020, which is 2 years ago, in Florida alone, more than 6,150 people died from fentanyl overdose only. And in 2021, they said that the latest provisional drug overdose death count also indicate that there is an increase of fentanyl overdose uh, related to synthetic kind. So they put a big warning. Okay, the public health department. So what they said all Floridians are advised to remain vigilant of the sign of fentanyl overdose and current public health. So, because of that increase of overdose and death related to fentanyl, um, now they categorize that as a public health risk. Okay, especially law enforcement and first responder and healthcare uh, providers. So they need us to be aware of that. So okay, so we have two type of fentanyl, right? We have the for pharmaceutical fentanyl. This is the kind of fentanyl so you found in a drugstore. So and we found also the illicit one, the illegal one, um, fentanyl. So the fentanyl we found in the pharmacy come up with that different type. Okay, we can get we can have different type of fentanyl. We can buy it. Like let's say, first of all, we need a prescription drugs to buy that. Okay, it's prescribed, and there's a different type. The different type of fentanyl we can found, we can. I mean, the provider can prescribe. It can be fentanyl patch. So it's a patch. So we can put it, either your arms, your legs, your back, um, different part of your body. Also, we can find nasal spray, fentanyl nasal spray. This is a spray, so they can spray it, inside your nostril for pain. Also, you can have sublingual spray on your tongue. There is also IV drip, so IV fentanyl. Okay, and also there is lollipop ones. The lollipop fentanyl we call it Actic or Fentora. So it's like it's like a candy. The people, the patient can suck on that fentanyl lol a lollipop. Um, that kind of uh, lollipop fentanyl, usually you see it in cancer patient, end stage cancer patient, end stage AIDS patient. They prescribe that. So this is the type of fentanyl you can find, which will be prescribed by a provider, by doctors or nurse practitioner or a PA. And again, as I said before, fentanyl is prescribed for moderate to severe pain. It's not for mild pain because it's potent. So it's for really somebody who really have acute or chronic severe pain. Um, so, what are the signs of fentanyl overdose? Okay. Um, Fentanyl overdose can happen to anyone who using it. So, if it's prescribed by a provider, you know, they know exactly how much we provider know how much to prescribe. Okay, in order not to lead to overdose situation. However, some people, they might have, um, they might take too much, or sometimes they might, the counterfeit. They might buy it somewhere, on the street. They sell that. This is illegal, and this is one of the reason we have those overdose and those deaths. So it can be, anybody. It can be your brother, can be your mother, your children. Um, anybody can affect, with that situation per se. So it's good to know, the sign and symptom of overdoses. So if we see that sign and symptom, we can call 911, so we can call for help. So what are the sign of symptom for fentanyl overdose? First of all, you can see small or constricted pinpoint pupils. So that person pupils, the eyes, the little round, um, black round form, inside your eyes, it can come smaller. Usually, most of the time is, if we look at the if we look at light, we can see it. But sometimes also, if you know that person, and you used to look at that person, eye contact, and we can see, we it we can spot that. And the next sign and symptom is falling asleep or losing consciousness. So if you see that person, used to be a person alive, that person used to, uh, uh, talking person, chat a lot, and then suddenly that person become like y- you talking to that person, that person is falling asleep on you, or loss of consciousness. This is a sign also. And that person, breathing is slow and weak. So kind of, their breathing is kind of shallow. It cannot take deep breath, superficial breathing. This is one sign again. And choking and gurgling sounds. If you have someone who, like, when they are breathing, they have that choking sounds, or gurgling sounds, like they have, like, secretion inside their throat. If you know that person is on fentanyl for pain, or you suspect that person taking, substance that you're not supposed to take. So this is one of the sign. Limp body, so that person cannot walk straight, that person is limping, like something is not right, the way that person walk. This is another sign. Or cold and clammy skin. So if you see, you have your loved one who is sleeping a lot, so touch their skin to see how is their skin, if their skin is hot, warm, or cold and clammy. So cold and clammy, so that's meaning the circulation is not well. So this is a sign also, because we're not supposed to have a clammy or cold skin. All right, so the skin's supposed to be warm. When you touch the skin, it's supposed to be warm, not hot, but warm. That's meaning the blood flow, it's, normal, is going. And also, one of the signs and symptom is discolored skin. especially the lips and the nails. So if the lips is discolored, like kind of bluish type, um, in medical world we call that cyanosis. So if you see kind of the lips is kind of bluish, for the darker skin, it's more difficult to see it. But if your skin is, if you have a light skin, it's easy. You can see that. And the nails also is not pinkish. The nail going to be like bluish type. Also, the tip of your fingers also, you're going to see pale, kind of bluish thing. Is a sign also. It's a sign that can be a fentanyl overdose. Okay, that person needs help. You need to call 911. And if you have uh, oxygen, if you have O2 oxygen pulse oximeter, if you have pulse oximeter, this is the little device who can check your oxygen level. So if you see that person with all those kind of symptoms, first thing you do, take uh, your O2, your O2 pulse, your oximeter. So check that person, put it in one of his finger and check his O2 saturation. So if O2 saturation is less than, let's say it's less than 92, um, that's no good. Okay, we need the O2 saturation should be 92 and up for anybody, body, because when your O2 saturation is below 70, like 60, that person needs to be intubated. So that person needs to be intubated so the machine can breathe for that person, because it's not compatible to life. So check the oxygen level. If it's less than 92, that person, try to wake up that person. If you have oxygen at home, give him oxygen. If he's not, it's time to call 911. Okay, so what do you do if you think someone or your loved one is overdosing on fentanyl or in anything, but the topic of today is really the public safety is really on fentanyl, because this is a crisis, really. In Florida, it's a big crisis, and I do believe it's not only in Florida. It's nationwide. But you can be overdosed by morphine, Percocet, any narcotic, any controlled substance. That's why they call it controlled substance. We need to control that, because you can be overdosed by those substances. So what do you do? Okay, let's say your loved one, or you have someone who is overdosing. You think that person overdosing on something, either fentanyl, either morphine, either Percocet, um, you know, could be Xanax too, even though it's not for pain, but it could be any controlled substance. Someone can be overdosed. So what you do first, you call 911. Call 911 immediately. And also, they said the second one, you administer naloxone. Naloxone, it's if you have it. What is naloxone? Naloxone is Narcan. Let me write it. Let's go. Let's go on the board. Okay. What is naloxone? Okay. So you have antidote, right? Antidote for you, naloxone or Narcan. So What is naloxone or Narcan? Naloxone or Narcan is an antidote to reverse the side effect of any overdose medication. So let's say you overdose with morphine or you overdose with fentanyl or Percocet. So if you give that person the naloxone, immediately that individual will wake up. So that's how we know it was. We can be sure that that person was overdose. So how you give that? It's short. It's injectable. So you give it. IM. If you have it at home, you give it, and then that can save a person life. So that's what it is. This is an antidote for, I think antidote take E, yeah, for any overdose substance. If you have it, you give it. You give Narcan, and also try to keep that person awake, breathing. Okay, so rubbing that person's chest, wake him up, put some cold compress, in his on his face. Talk to that person. Try to keep the conversation open so that person can answer you until 911 come. And also, you also, they said, that person, try to lay that person on their side to prevent choking or aspiration, because that person might be vomiting as well. So if you place that person on their side, even though that person, they vomit, the likelihood for the secretion to go into their trach their trach their trachea or their lungs will be less. So position that person on their side, to prevent choking or to prevent aspiration, and also remain with that person until 911 personnel come for assistance. Okay, so that's what you do. Um, if you suspected someone is overdosed with fentanyl. And yeah, so again, there is two type of fentanyl. There is pharmaceutical fentanyl. So pharmaceutical fentanyl was developed or created to manage intense pain. So, like I said before, it's fentanyl was created, created by pharmaceutical company to help control severe pain, like intense pain after surgery, or and sometimes we use it also to treat patients with chronic pain, such as people who has cancer. This is chronic pain. Um, so fentanyl can be administered as a shot, like in injectable patch, or you can use it also lozenges, like candy type. Okay, and in prescription form, it is known such as Actic, Duragesic, or sublimate. This is kind of they're different names. Different name can it's uh, just will relate it to one medication, to the fentanyl. The name can be Actic, Duragesic, can be like I said before, there can be Fentora. You can have again, nasal spray, you can have sublingual spray. So there's different form. So the pharmaceutical fentanyl, as I said before, is prescribed, is controlled. The provider, the doctors, the nurse practitioner, the physician assistant, they know exactly how much to give. And usually, if they send you home with it, they will give you for 7 days. Okay, they're not going to give you for so many days in case that person has that tendency to take more, that person won't be overdosed. So the 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 safety issue is when we are dealing with the illicit manufacturers fentanyl. Okay, so what is that? Illicitly manufactured fentanyl, which is most often associated with recent overdose. So pharmaceutical fentanyl can be associated with overdose, but less because it's controlled. You have a provider who prescribe that, because if we prescribe more than we shouldn't, we are our license. It's online. It's in line with all those things. So it's very, first of all, before we prescribe, okay, any narcotic, there's a search we do, in the computer. We call that that search, we call that PMD. Okay, there's a search we do. So what PMD does, we put that person name, that person name. There's a special website. We put that person name, the date of birth, and everything. Whatever they ask us, we put there uh, that person information. So by putting that information, what he does, he pull all the providers, the that person goes to ask for narcotics. So we have a list. Okay, let's say that person is a narcotic shopper. Okay, that's what he does. He go to different doctors or providers to get his or her narcotics. So automatically, when we prescribe narcotics, is it registered, in a central place. So we're going to get all those information. So we know really if that person is shopping for narcotic or if that person really, he needs the medication. So this is the beauty. Before we didn't have that, couple of years ago. Now we have that now. But if that person buy it, those medication, those illicit medication on the street, how are we going to know? We won't know. So that's why the fentanyl overdose now is a public health issue. It's a safety issue, and the health department really want to advise all the providers, to look for it, to educate people for about with that uh, health, public safety. It's a big one now. So what is exactly, so as I said, the pharmaceutical one, fentanyl, is controlled, provider prescribe it. We go to the database and make sure that that person didn't go to someone else, to another doctors, another a provider, to prescribe the same thing. So we have a way we can track that. We have a way we can make sure that this is not duplicate orders. So it's also that will prevent also overdose by doing so. So the problem now is the illicit one. When they have the illicit one, we don't know where they got them, how they got them. They just got them. So exactly what exactly it's illicit one. The illicit manufactured fentanyl, okay, which is most often associated with recent overdoses. That's why we are talking. Is found in many forms, including powders and liquid. This can be sold illegally as the provider drop onto blotter paper, put in eyedroppers and nasal spray, and made into pills that look like other prescription opioids. So there's a lot of counterfeit fentanyl there. So people have to be aware of that. If you have your loved one, talk to your loved one. You have your children, your brother, whoever. Talk to them about those things, not to buy them, because you don't really know what is inside those medications. They mix them, and sometimes people die. We don't know what they have inside. What they mix those medications. That's why illicit one is very dangerous. Fentanyl may be added to illicit drugs during their production without the drug user knowledge. Okay, so what they said, those illicit drugs, people bought on the street, they can mix the fentanyl inside it. Okay, okay, they can mix it. They will find it somehow, somewhere. They mix it, and that's when it becomes so dangerous because you don't know what is in it. According to U.S. drugs enforcement uh, administration, which is the DEA, because the DEA, they are the one who really regularize the controlled substance. Okay, so like in United States, if you have to prescribe controlled substance, you have to have DEA number. They give you a DEA number. Every each provider, MDs, DOs, nurse practitioner, physician assistant, we have um, um, an individual DEA number. So, so everybody has their own DEA number, okay, to prescribe narcotics. So, which means uh, any controlled substance, not only narcotic, only controlled substance, which is can be active or not even for anxiety, help you to sleep, can be Xanax, can be Valium, for anxiety, for your mood. Those things, they are controlled. So once you prescribe it, the database get your name. Your name is there, so they know who prescribed what. So that's why it's very important. And so they said, according to USDA warning in September 2021, just last year, illegal drugs are usually made to look like prescription pills, available online and sold through social media. So the DEA knows that, okay? The DEA knows, so they try to mimic whoever's doing those things, they try to mimic the illegal drugs to look like prescription pills, and you don't know really what is inside those pills. This is the danger of it, okay? Um, yes, fentanyl, we prescribe fentanyl. There's a reason people have severe pain, like acute or chronic severe intense pain, that will help that person going to feel good, yes. But when it's illicit one, you don't know really what they mix, and they always mix stuff and nobody knows. So that's why people have to stay away from those illicit drugs, because that can be fatal. um And what are the common use street name for illicit manufactured fentanyl? I think this one is very important. So, common names. Let's put red. Uh, mm, Common names for illicit fentanyls. Okay. So they have different names, right? On the street, they have different names. So one of the names on the street we have for illicit fentanyl is Apache. Okay. If you hear a young one or someone talk to you about Apache, it's an illicit fentanyl. The other name for illicit fentanyl is China girl. Okay, so I think it's I think it's a sling. It's a sling. They come. You know, people won't discover, won't recognize, won't know what they are talking about. So Apache, China girl, Chinatown. Okay, they come up with all those names. Chinatown, China White. Okay, Chinatown, China White. The other name they have is Dance Fever. So if you hear somebody talking about Dance Fever, all those names, they are talking about one thing, illicit fentanyl. And we have other name, good fellas. Okay, good, good fellas, like good fellows, but they don't say fellows, they said fellas, good fellas. And what other name they have? Other name they have is great beer. Great great beer. Great beer. This is another name they use. This is a street name they use to refer to fentanyl. Illicit, um uh not the um legal one, not the legal fentanyl one, which you can, they can be prescribed and you go to the drugstore, you get them. This is okay. They call it great great bear. The other one they call it He-Man. All the street name for fentanyl, He-Man. The other name jackpot. They call it also jackpot. I don't know what kind of jackpot is that going to kill you, and they call it jackpot. Um, they call it also murder eight. That's a great name because for real, you're going to kill them for real. Murder eight. This is another name. They call it tango. They can use it. They can use the. They can say tango, and or cash. Okay. So this is all the street name. I think it's very important because especially when we have young one, okay, when we have your young one, sometimes they are talking on the phone, you overheard them talking, you don't even know what in the world they are talking because they are using their slang, they are using their jargon, we don't even understand what they are saying. So if we know those kind of of street name, maybe that can ring a bell. Said, oh, what he's talking or what she's talking. So again, the commonly used street name for illicit um, manufacturers fentanyl, they are Apache, China Girl, Chinatown, China White, Dancer Fever, Goodfellas, Great Beer, um, He-Man, is another word, Jackpot, Murder 8, Tango, and Cash. This is all street name. So remember those names. Um, if you hear it somewhere, so at least you can know that exactly what they are talking. They're talking about illegal, illicit fentanyl. Okay, why we are accent on that is because of it's a health crisis. The overdose can cause death. Okay, and as we can see, lately we have so many overdoses. Okay, about those medication. Sometimes we can even pinpoint which one because they mix them so much. They take anything. They take marijuana. They take fentanyl. They take um, cocaine. They drink alcohol on top of that. It's a recipe to for death. So that's why if you can talk to them. I mean, personally, I think it's hard when they're adult. It's hard to talk to them because they choose what they choose. The kind of life they want to do it. But some of them they are receptive. Some of them, especially if we are in a healthcare, we need to educate them, and that's why I want to do. I want to educate the population. Even though if one person can be saved, my mission, it's my mission will be accomplished, because one life, saving one life, this is a lot. So I mean, it's when I saw that email, you know coming from health department, I said, wow, this is really a health crisis. And also when we travel, when we driving around, and as I said, my coworkers, I said, lately we saw so many homeless people. I didn't used to see that. I've been in Florida since what, 1990, and for the past 4 or 5 years, to me, it seems to me that the rate of homelessness has been increased. And when we talk about homeless, we talk about addiction. We talk about, they are taking, they are drinking heavily, drugs and everything. And overdose in that group population is very high as well. So, so that's why I really wanted to come today and talk to you guys about um, public health crisis, which is the fentanyl overdose. So, just we have to keep an eye open. It could be, that can affect anybody. There's no uh, social, there's no class social. It can affect the poor, the rich, the middle class, anybody, girl, boy, women, female, anybody. So we just have to be, on alert to recognize the sign and symptom. Okay, again, what are the sign and symptom for fentanyl overdose? I'm going to, before I leave, I'm going to repeat it again, because we can never hear enough about sign and symptom, about what to do. If we suspected that someone or our loved one has a narcotic overdose. It doesn't have to be fentanyl really, because overdose can be anything. It can be from anything controlled substance. Okay, can be from morphine, from Percocet, from, because if they take too much, it can be overdose too. But for the topic of today, we accentuate really on fentanyl because it's so potent, it's so strong. Okay, so again, before I leave, let's review the sign and symptom. Sign and symptom for um, fentanyl. Sign and symptom for fentanyl overdose again is what? It's someone pupils, the middle part of your eyes, the center part of your eyes, if it's means become smaller. If it's become smaller, because if you used to speak to your loved one, sorry, if you used to speak to your loved one, you can, you look at the person, in their eyes, you really can know exactly the size. You can have an idea. If it's constricted, you can know also. But the best way to know it is to flash your eyes with a flashlight, so you can know if the pupil is smaller or what. But this is one of the sign and symptom for overdose, is small and constricted pinpoint pupil. The second one, falling asleep or difficulty to be awake, difficulty or losing consciousness. So that person, it come and goes. He talk to you and he fall asleep, come again, talk and fall asleep. Second one, slow, weak, um, or not breathing. If that person, their breathing is slow, weak, or not breathing, it can be a sign of fentanyl overdose, or any substance overdose. By the way, choking or gurgling sounds, like saying that person like have secretion inside their throat. It's like that person cannot really um, spit it out. They're gurgling. Also, limp body mean that person cannot walk straight. They are limping. Cold, their skin cold and clammy. Anybody, any normal person should have warm skin. Your skin, because what happened? Your blood flowing through your veins keep your skin warm, keep your body warm. So if your circulation is impaired, it's become cold and clammy. It's another sign. And also, if you have discolored lips and nails, so especially people who is light skin, their lips can be bluish, kind of light blue, and their fingernails too, instead of pink, can be light blue too. Or and also the tip, not only the fingernail, also the tip, like the tip or your fingernail or the tip of your nails. You can see discolored, like whitish, bluish kind. So this is the sign, okay? So what to do if you suspected someone with overdosing behavior? If you suspected someone overdose on something, okay? Anything. It can be fentanyl, can be morphine again, can be Percocet, can be oxycodone. If you suspect someone overdosing, what you do first, you call 911. So you need to get your help as soon as possible. Call 911 and wait with that person. Try to engage that person to talk to you, okay? So that person can, by talking, bringing oxygen into his body. So if you have a pulse oximeter, take his O2 saturation to see how much is his oxygen. If his oxygen is 92 and higher, is good. If it's less than 92, if you have oxygen at home, oxygen supply, give him oxygen. And or if you don't have oxygen, help him to breathe. Tell him to take deep breath, help him to breathe. Also, if you have Narcan, if you have naloxone, which is Narcan, it's an antidote for narcotics. So it's injectable. You inject that, they will, the package will tell you exactly how to do it. It's injectable, as a needle. You inject it, and automatically that person will be awake. If if it's an overdose with controlled substance, um, I mean narcotics, I would say. So keep that person awake and breathing as much as possible, and lay also try to lay that person on their side, on his or her side, because to prevent choking and to prevent aspiration. And again, stay with that person until, don't leave that person sight. Stay with that person until 911 personnel arrives, and then they can take the lead when they come. All right. So on that, I will. That will be it for that topic. Hopefully, that help. Uh, that help. To know what is fentanyl overdose, and also what kind of sign and symptom to look for. Um, Before I leave, let's leave on God words. Okay, God words about health. What God said about health. Also remember, we are not only physic. We are body health. We are body, mental, and spirit. Right. Um, so it's a sum. Our body is a sum of all those components. And I believe that we are make of spirit. We are physic also, and we are mental also. So what God said about health, okay, in uh Jeremiah 30 verse 17, he said that I will restore health to you and heal you of your wounds, says the Lord. So just, I know it's hard. I know that, when we sick, we feel that, sometimes we feel hopeless, we feel helpless. But remember, God is the greatest physician. God can heal us. But don't think that God will heal us like that by doing anything. Yes, I know miracle can happen, but always remember, that's why we have hospital. That's why we have personal health people, doctors, nurses. We have all those nurses in the hospital to help restore our health. This is how God helping us, by providing those people to help us. I don't believe that, like people think, they are sick, but they're just waiting for a miracle like that to happen to heal them. And sometimes it's too late. Sorry to say that. And sometimes it's too late, because God give us, um, God put things in our disposition to help us. It's up to us to know to use them, to go look for help when we need help, and to look for help to the right place also, not to the wrong place. On that, I wish you best of health, and until next time.